So I'm just going to get started. This is the ethical integration of cannabis science into nurse coaching practice. And I'm Nurse Courtney. And just a little bit about myself. I am a advanced practice holistic nurse, board certified. I have a master's degree in public health, and I am specializing in the integration of cannabis science. So I have the Center for Integrative Nursing and Cannabinoid Science, and you guys can find that here on Facebook and on the web at cincs.org, cincs.org. And the work I do is I really focus on the vulnerable and making sure that I'm providing for the protection and public health of vulnerable populations seeking cannabis therapy. And most of these people are, everybody has a testimonial, right? So anyway, that's the work I do. I'm building curriculum and really trying, to set an international standard for how nurses integrate cannabis, and trying for people to understand that, we're dealing with a public health issue. And so that's one of my primary goals, is to really bring the focus to sort of the multidimensional aspect of cannabis integration into public health. And so here we are. So anyway, I just want to take a minute. I'm kind of a little disoriented with this screen because I know I can see people if I do something, but I'm not quite sure how to do that. And so I know I'm live, but I don't know what to do. So let's see. I'm going to, well, actually, I guess I'll just keep going, okay? And hopefully it's working. I see that there's a number there, so I'm hoping people are coming in, and and that's what's happening. Well, meanwhile, while we're here in this space, as holistic nurses, one of the things that we always try and do or focus on is really bringing people into, okay, I just saw a heart. I don't know what that means, but just bringing people into a shared space and creating a sacred space. And so that's what I want to do while I have you all here, or we're getting started and people are coming in, or everybody's getting settled, and I have my tea here, and so I'm ready. And so what I'm going to do is I'm just going to ask you, as you are coming in, to just settle yourself in and just bring yourself present to this space and what's happening here. And I'm going to call in the Ascended Masters, and I'm going to call in myself, and I'm going to call in all of you as future Ascended Masters to help create a sacred space for this work to be done. And I'm going to ask us to sort of just align ourselves along our center energy line and get into kind of our channel of light and invoke our highest self and our body deva highest self and our crew. We all have spiritual crew that surround us. We simply have to ask them for help in the higher realms. And so I ask that we invoke the spiritual crew to surround us in this work and hold a high vibration to activate the grids and the guides and the sacred symbols in the highest realms in order to do this work. Okay, great. So as we're here, we're going to set the intention that what you're going to walk away from in just a few minutes is just a basic understanding of what the problem is, who the population is, and how we intervene. Okay, and just you need to know how to stay safe. Okay, for your practice and for patients, because that's what this is ultimately about. Is we want to make sure that we are practicing, to the best of our ability and being able to give our patients everything they need to be their own best healthcare providers. So I took a few notes. The problem is there's 3 million people in the United States that have recommendations for cannabis medicine, okay, and they're using cannabis medicine without benefit of nursing care, okay. So there's no formal nursing programs, there's no formal standards, there's nothing like that, no really practice guidelines. There are things out there that are feigning standards and feigning guidelines, but I do believe they fall, short. The problem is that the population seeking cannabis are vulnerable, okay? They've either come from the failure of Western medicine, or, they're people who are used to using traditional medicines anyway, which means they're usually, people of color or, households like that. So either way, it makes them vulnerable, and frequently people turn to complementary alternative medicines when they've had the failure of Western medicine and they have no other choices. So then they come in and, they're dying. I mean, literally my nurse coaching population are people that have no place else to go. So by the time they come to me, I'm their last resort. So I just really have to take that into account, that what they need right now. So this population is extremely vulnerable, failure of Western medicine, and frequently what you have are somatoform diseases like fibromyalgia, irritable bowel, multiple sclerosis, things that really have no, pinpoint etiology. These are frequently diseases that, we're finding are more and more related to endocannabinoid deficiency syndrome. And I'll talk more about that later. Anyway, what's our solution for this, for having this population without, properly trained nurses, is to teach, develop, and practice, and train nurses according to a well-established nursing theoretical models, okay? So we already have existing theoretical models that tell us how to approach this. And that's what I do in my work, is I've taken Barbara Dossey's theory of integral nursing, and taken it down into, mid-range theory, and I utilize it to guide practice. And that's what I do, is I teach other nurses and nurse coaches how to practice safely by using theoretical nursing models, okay? And so if everyone's familiar with the theory of integral nursing, it's, it's a multidimensional nursing model that allows you to take, the meta paradigm of nursing and, ways of knowing and holistic nursing, and, all of these things are stacked in this nursing model, but ultimately all of these things have to do with dealing with the patient's experience in a multidimensional way, the 4 quadrants of being. And this is information that I did post in the event page. So you have a whole article on the theory of integral nursing. I think it's really important that people read it. The parts that are, that are really important to remember is that we go through that model, that 4 quadrants of being, in order to help understand how to help people that are coming to us for help with cannabis integration, right? So, in that it's I, which is the subjective portion, how a person feels, what they think, what they're doing, is there something happening that I don't know? There's all these little bubbles. Anger, oh my goodness. Anyway, so, the I portion is that portion of that person who might feel guilty for using cannabis medicine. They've got everyone saying it's wrong, whatnot. And so, that's a subjective, something somebody has to think about. The it, which is, another quadrant experience, is the body. It's what it can be measured. It's the external behaviors. It's the pain that person is in. That's why they're seeking cannabis medicine. If we move down to the its, we look at the lower, if we move down to, this is hard, lower right quadrant, we look at, the structures and systems that people have to deal with in order to have cannabis medicine. You can literally be in Oakland or California, and you can get a half a pound of flowers, cannabis flowers, and you can put them in your suitcase and you can fly anywhere with them. But what happens on the other end is entirely different. So the legal landscape is entirely different. You can be a legal patient in California, and then you fly someplace else, and now you are a criminal, you know, who can go to jail for 20 or 30 years for simply having that same legal medicine. So we have to look at all of these things. And then of course we have the we, which is sort of this, I think I'm a little dyslexic, it's the lower quadrant. And that's where we interface with the nurse and the patient. So the whole point is to be able to help the client and these vulnerable clients, guide them through every aspect of experience as we go through our assessments, as we work with them, as we do our coaching, in order to make sure that we're approaching them in a multidimensional aspect, okay? So the theory of integral nursing, like I just said, you know, focuses the patient's, you know, on the patient's entire being. And in one portion of the theory, in the quadrant where there's the we, the nurse interfacing with the client, what we're seeing is we're missing nurses in that space. And so part of what we have to learn how to do as nurses is to understand how to work in that missing gap. And, you know, part of that is understanding that, number one, we're dealing with a vulnerable tertiary prevention public health population. So I'm not sure if everybody knows about their public health levels, primary, secondary, and tertiary, but at the tertiary prevention public health level, that clients already have a disease condition, acute or chronic disease. So they're coming to us for help in making sure that they're not experiencing early death and increased morbidity due to that disease. So the nurse really is in this space acting as an instrument of healing, you know, through coaching, diet and exercise, you know, diabetic protocol care, just anything, checking blood pressures, helping people, you know, with their lifestyle. And so in this space, that's where cannabis patients are really missing. And, you know, in particular, when they go into dispensaries, and they're trying to figure out what the best medicine is for them, okay? They have their recommendation. Now they're going to buy their medicine. They walk into this organization and there's just multiple choices and multiple products that they can try. And there's so many choices that they really don't, you know, you're not given any guidelines, although there's very clear guidelines out there. And then the people that tend to be in the store are not nurses. They are simply bud tenders. So they have, you know, experience with cannabis, and a lot of them are very good, but they do not have formal training in physiology and symptom management and integrative care. They do not have it. So they're literally treating people with, you know, cancers and, you know, very acute disease states that are trying to cure themselves. Think about these epilepsy moms, you know, with these babies walking into these places and asking someone who's just treated somebody, you know, because they were a child or they knew it was a friend or whatever, or because they smoked weed, you know. So they're asking them these questions. So it's a real, you know, gap in public health care, and people do deserve this care. And the unfortunate part is because as nurses and healthcare providers, because they're not getting the care in the hospitals, they're not getting the care in their doctor's office, they're not getting the care from nurses, they have no place to turn to except for YouTube, the street, anybody that can offer them any information. And if you look in the cannabis market, you'll see that the market is flooded with people giving advice, and they, you know, their legitimacy is that they actually experienced a cannabis cure. So, I mean, that's okay, but it's, you know, it's not nursing. So it's really important that we do something in the space for vulnerable people in this population. They are a tertiary prevention public health population. So we really are acting in a public health role. It is very much a public health role. And then, you know, we want to make sure we get everybody involved in that. So the thing that really is missing in nursing in that space is, you know, nurses are an instrument of healing. And so just being present in that space changes the circumstance for, you know, the people. So don't underestimate, you know, our power to really do, you know, just by being there. Like sometimes we just have to be there to hold the space, and that's all we need to do in order to advocate and care for these patients. So So the next thing I want to talk about is actually the model that we use to integrate cannabis. And so we have this vulnerable patient population. They're coming to you as a last resort. They want information. How do you help them? Well, number one, you know, it's by law, we cannot recommend even vitamin C. We can't tell a patient to take any medications. We can't do anything like that. So what we have to do is we have to practice according to a practice model that's non-interventional, okay? Even nurse practitioners cannot recommend anything to anyone outside of their own clients, even nurse practitioners with prescriptive powers. So we do have to be very careful about how we manage ourselves. And yes, it's true, you know, lay people do not live by the same rules that we do. However, so what we use is what's called the consumer model of nurse herbalism. And I did post something about that. And this was developed by Dr. Martha Matthews Lipster, who is a leading herbalist in nursing. And so this is a well-established nursing model. And the consumer model of nurse herbalism literally puts us in a position where we are not intervening. We are not, you know, doing any intervention with the patient. We are simply acting to protect their right to self-determination by giving them evidence-based information, okay? And every patient is entitled to evidence-based information, and our jobs as nurses are to provide patients with all the information they need in order to make their own best healthcare decisions. And this is, you know, what's called the right to self-determination. You know, even the International Council of Nurses writes a statement about that, and there's a provision 10 on medical cannabis with the American Nursing Association that says patients are entitled to have cannabis information, and nurses need to be trained in cannabis information in order to deliver that. So with the consumer model of nurse herbalism, when patients come to you, this is something that you can utilize in any practice setting, because you are adherent to all practical nursing, you know, standards of practice as far as ethical practice. And, you know, you can find those anywhere on the American Nurses Association website. And you can look at Provision 10 for the statement on medical cannabis at the ANA website, and I'll post it for you. And so what that says is, by helping patients understand all their treatment options, by honing in on their questions and finding good, solid evidence and giving them the research, then we can, you know, help guide them. And so this is what I do in my practice. If you ask me a question, I follow it with the research, you know, and I say, this is what the research does, and this is what the research says. And it's incumbent upon us to make sure that we're getting well, you know, peer-reviewed research, non-biased research, and we have to monitor ourselves for our own bias. So it's really important that we do the best for the clients through just giving them this research in this non-interventional model. So the consumer model of nurse herbalism, I did post information about it, and I will post some more so you have a better understanding. It is not complex, but it is really important that people understand that this nursing model is there to protect both them and the client. So I just wanted to talk a little bit about the endocannabinoid system as we're running into, you know, the last few minutes. I'm going to just be able to have a couple times for, I don't know, a question or answer. I can't really see anything. So the thing about the endocannabinoid system is it is the main system that regulates every system in every vertebrate's body. The endocannabinoid system everyone has, every vertebrate has, and it has existed, it's predated humans basically, because we have found endocannabinoid system in sea slugs. So before we even walked the earth, the invertebrates had endocannabinoids. And perhaps even before the plants existed, we don't really know. But what's clear is that cannabis, the plant cannabis, has adapted us to live with the plant. And so You know, we're learning about it. I'm teaching about it. This plant has been in our experience and in our existence in culture for over 10,000 years. So we do know that. There are 3 types of cannabinoids. There are phytocannabinoids that you find in the plants. There are endocannabinoids that are existent within us. And there are synthetic cannabinoids, which I do not recommend under any circumstances. Within our own endocannabinoid system, we have receptors called CB1 and CB2 receptors. So CB1 receptors are in the main central nervous system, the hypothalamus. They are important in the hypothalamus pituitary axis when our stress response. They're also important. It's implanted after 10 days after embryonic implantation, we have registered anandamide, which is our equivalent of THC. It's the molecule of bliss. And this molecule is responsible for cellular proliferation, migration, and neurogenesis of new cells during either embryologic development or pathology. So, you know, like after you get hurt, you get an injury and you have to learn how to walk. That's your endocannabinoid system kicking in to literally send new cells, you know, new neural cells to a different part of your body to establish, you know, a connection. So it's an integral part of Hebbian wiring and fire and how our neural circuits are wired together. So every time you think a new thought, you learn a new behavior, you're actually activating your endocannabinoid system. So we have CB1 and CB2 receptors, and then we have ligands, anandamide, which is equivalent of internal THC. It's called the molecule of bliss. It's what makes you happy when you get in the bathtub. It's what, when you start meditating, you feel relaxed. That's your own internal THC. We have 2AG, which I can't even say the non-abbreviated names right now, but 2AG is a retrograde signaler that literally shuts down the signals that are coming into a cell prior to the cell that it's receiving. So it just stops any kind of, you know, cellular signal, that cellular pain signal. It just disrupts it. So, and then we have a couple others. There's a GP55. So these things are endocannabinoid receptors, CB1 and CB2. CB2 are primarily in the immune system circulating. CB2 receptors are intricately tied to glial cell activation and to inflammatory response and things like that. And that's why cannabis helps with inflammation. Literally CBD, which is cannabidiol, shuts down the microglial response. So when we get those T cells and B cells that go in there and start chewing up stuff, cannabidiol just stops that. And so you get that anti-inflammatory response. And so, so we have our endocannabinoid system that's responding all sorts of things around us, pain receptors, you know, all of it. And then regulating homeostasis when we get afraid, when we get in pain, when we get, you know, we learn new behaviors. It's helping us define who we are, you know, cognitively and consciously from the external environment. And the most interesting thing about the endocannabinoid system, as far as I'm concerned, is that this cell, the CB receptors, actually are what's called a 7-chain serpentine cell. So it goes back and forth through your cellular membrane, and then it goes across the cellular membrane inside and connects to all the little apparata and then out the other side. So they're really intricately connected to, you know, our integral system, the energy system, they're responsible for metabolism. It's a very, very interesting, you know, system. And I don't know, I love the science. So, you know, science aside, it's also connected intricately to quantum theory and Pergoni's system of dissipative structures. And that's connected intimately to Margaret Newman's health as expanding consciousness. Because what happens is we get into an accident, you know, we're going along, we're an energetic pattern, a unitary, you know, being, as Martha Rogers says, and boom, something happens. We get, you know, like me, I fell, I hurt my back. So, you know, you have to regroup, you have to get organized, and you know, I'm not able to do all sorts of things. So the endocannabinoid system helps you regroup into a higher level of consciousness, of being, as you heal as you, you know, come back to being in a state of well-being. You kind of get rid of everything you don't need, just goes away, and you're actually going to be far more organized and your consciousness expanded. And I fully, you know, expect that with my back injury at this time. So I hope I answered a lot of questions. Oh, there's a couple things I wanted you to walk away with is you can activate your endocannabinoid system easily. Hemp oil in the grocery store is full of CBD acid. CBD acid is an autoimmune modulator. Hemp oil in the grocery store is actually all full of every cannabinoid. So if you take that hemp oil in the grocery store, you're getting all of the omega-3, 6, 9s in the most perfect ratio, which would feed your phospholipid bilayer. So, you know, hemp oil in the grocery store, it's a great thing. And then, you know, another way to activate your endocannabinoid system is meditation. Every time you meditate, every time you smile, you're activating your endocannabinoid system. When you think happy thoughts, you're activating your endocannabinoid system. Anything that actually feels good is activating your endocannabinoid system. And then a hot bath. If you really need to, you know, get blissed out, get in a hot bath. It takes me about 30 minutes, 45 minutes, and then I'm completely, you know, just completely in bliss. And raw chocolate. Raw chocolate does not have anandamide in it, but what it does is it has fatty acid hydrolase, which prevents the breakdown of anandamide. So if you eat raw chocolate cacao, you will help to also boost your endocannabinoid system. And remember, endocannabinoid deficiency syndrome is real, fibromyalgia, Crohn's disease, you know, all sorts of things, PTSD. So, you know, I can't encourage you enough to consider the benefits of hemp oil. And that's it. 29 minutes and 20 seconds. I'm done. Okay. And I guess I'll take questions. I don't know how to do that. I'm going to hit finish and see what happens and go back on the website in the Nurse Coach Connection and find out what happens. Okay.